I have an order from Dr. B to administer 40 milligrams of Lovenox. I'm going to be doing that by the 6 rights of patient medication. That's right patient, right dose, right route, right time, right date, and right documentation. So the first thing I'm going to do is I'm going to go ahead and check the MAR, and I do see an order from Dr. B. I'm going to compare that to the MAR that I see 40 milligrams of the Lovenox. So the concentration there is 10 milligrams per 0.1 mils. So we are going to administer 0.4 mils of that Lovenox. And I do see it is to Bob Johnson in room 115. I'm going to go ahead and go to the dispensary and remove my Lovenox. So I do see that there is an air bubble in that Lovenox, so I'm just going to go ahead and shake that out. It's not coming out very good. Perfect. Okay. In addition to that, it is the right medication. It is the Lovenox. It is the correct dosage. There are no particulates, and the glass is intact. There is no broken, and it is a single dose vial, so I will be throwing it away after we use it. Okay, so now that we have that ready, I'm going to go ahead and use this alcohol pad. Just use this as my sterile surface. And I'm going to go ahead and take this. I'm going to use this to break the sample. That down there, and I'm going to dispose of this in my sharps so I don't get stuck. Okay, the next thing I'm going to do is I'm going to go ahead and prepare my needle. And get it going. There we go, and that is on my sterile surface there. I'm going to take my filter straw out. Go ahead and draw up the 0.4 mils. Perfect. And I actually drew up a little over. I'm going to dispose of this so I don't need it anymore there. Okay. I'm going to go ahead and shake this out so that that air bubble moves to the top. It's taking its time. Okay. I'm just going to go ahead and push that up there. And then I'm going to go ahead and draw out my 0.2 milliliters of air. Perfect. Okay, the next thing I'm going to go ahead and do is I'm going to swap out my filter straw. And I'm going to dispose of that. And I'm going to go ahead and reattach my needle here. Okay, now I'm going to go ahead and head to my patient room with my needle and my gloves and my gauze as well. Okay. Hi Bob, my name's Ashley.
Hi.
How you doing today?
Okay.
Okay, I have a medication order for a Lovenox injection. Do you remember what that's for?
No.
Okay, so that is just to keep your blood from clotting. Does that sound like it's familiar to you?
Yeah.
Okay, perfect. All right, so Bob, can you go ahead and give me your name and date of birth?
Bob Johnson, January 30th, 1956.
And do you have any allergies, Bob?
No.
Okay, so I'm going to go ahead and I'm going to check that against the MAR. And I do have 0.4 mils of my Lovenox. It is Bob Johnson, correct name, correct date of birth, and I do have the correct dose with the 2 mils air. So the next thing I'm going to do is I'm going to go ahead and wash my hands. And Bob doesn't have any allergies on the MAR. I did check that one as well. I'm going to dry my hands. I'm going to put my gloves on. Okay, so Bob, how we're going to administer this is going to be, you're going to kind of sit a little bit upright, and I'm going to pinch that left lower abdomen, and you're going to feel a poke, and then you're going to feel a little bit of a sting, okay? first thing I'm going to do is go ahead and clean that skin. Perfect. And while that's drying, go ahead and get my needle and everything ready. Okay. This is a lovely needle. Since it's not threaded, I would typically use a threaded needle if I had one. Okay. It'll be just a second, Bob. This is a little stuck here.
Yeah, that's been happening.
Just don't make needles like they used to.
In my day, they were made out of glass.
Okay. So now that we have that removed a little bit, go ahead and remove my cap here. I'm gonna hold this at a 90-degree angle and pinch up on that skin. All right, you're gonna feel a poke, okay?
Okay.
All right, poke. And then I'm gonna go ahead and inject that with the air. And you're gonna feel a sting there, sting, sting, sting. And then we're gonna go ahead and remove that. And I'm gonna go ahead and hold that gauze there for me, Bob.
Okay.
I'm going to dispose of this in the sharps container right away. All right. How you doing, Bob?
I'm okay.
Okay. So the next thing I'm going to go ahead and do is I'm going to document in the MAR that I gave it in the left lower abdomen, that I gave 0.4 mils of the Lovenox, and Bob's reaction to the injection. Bob, do you have any questions for me?
No.
Okay, perfect. I'll check back with you in a few.
Okay.